Okay, hello again. This is Dr. Bandele, Magic Emergent Care Mobile. Today we're going to be talking about gastroenteritis. The reason we're talking about gastroenteritis is we found it to be very prevalent quite recently. We've had quite a few cases, and we thought it's very important to inform the public what is gastroenteritis, how do we get gastroenteritis, and how best to go about treating it. What is gastroenteritis? Gastroenteritis refers to irritation of the gastrointestinal tract. Symptoms typically involve vomiting and diarrhea. We find that the diarrhea tends to be very watery stools, and the vomitus initially begins with what we've ingested previously and may go on to become just sort of clear gastric contents. It usually actually goes around in groups of people, so amongst the family or in schools or amongst the workplaces, and it's really spread from direct contact. So it's very important that when you have any symptoms, any family, friends with gastroenteritis, everyone must adhere to strict hand washing guidelines and make sure you're washing your hands thoroughly. Now, the symptoms and signs we mentioned involve vomiting and diarrhea. Some people may get stomach cramps, as well as there may be a low-grade fever found in some people. These are the typical signs of gastroenteritis. When should we seek medical attention? Now, we become very concerned when people have profuse vomiting or protracted vomiting and diarrhea, so they're expelling large volumes of fluid by vomiting or diarrhea, and they're not able to take fluids back in. This quickly leads to dehydration, and if left unchecked, it can cause us to be very unwell. Particular groups who are very prone to dehydration would be your children, so the pediatric population, as well as the elderly. So we tend to have a very low threshold for seeking medical attention for these two groups in particular, so they can get rehydrated. Other concerning signs that would prompt us to seek medical attention include passing blood in the stools, or also having any symptoms which may suggest something other than gastroenteritis. Severe abdominal pain is not one of the symptoms that we usually associate with gastroenteritis, so that's another cause for seeking medical attention early. If your symptoms go beyond what we expect, the normal duration, which is up to a week typically, once you go beyond that, I think you definitely need to consider that something else may be going on here and you need to seek a doctor's attention.